doctor. We're going to ask you some questions about skin cancer, specifically melanoma.
Hi.
So, what causes the disease?
Well, skin cancer has two major components. First, family cancer, family history, if it is melanoma, okay? And the other important factor is exposure to the sun, okay? So that can be either by the type of work you do or by sun tanning.
Okay, perfect. How serious is the disease and how does it affect the patient's current lifestyle?
Skin cancer, there's three different types of them. There's basal cell cancer, which does not generally affect the life of the patient. It can be removed, or if it doesn't get removed, it won't spread. Then we'll have squamous cell cancer. It is a little bit more severe than basal cell, but still it won't kill the patient, it won't spread around, and the most dangerous type of skin cancer will be melanoma. Melanoma can spread, okay, especially to the liver and the brain, and it may cause the patient death.
Okay, thank you. What is the patient's prognosis?
Well, melanoma, first two types of skin cancer, the patient prognosis is very good. For melanoma, it will depend on the stage at which it is diagnosed. If it has already spread, the prognosis is not a very good one.
Okay. What was the patient's chief complaint? Why did he come to see you?
Patient's chief complaint is a mole that's gotten bigger, irregular, changing colors, and probably he wants to get that checked.
Okay.
What other symptoms the patient have? Does the patient have?
With melanoma, you usually have no symptoms, just the mole. If it is a very progressed disease, you may have weight loss and fatigue, according to the site of metastases.
Okay. How was the patient tested for the disease, and what does the test reveal?
The patients get the mole removed, and we do a biopsy of that, or either first a biopsy, or usually you get it all removed and send it to pathology, and they will get you a diagnosis.
What were the patient's treatment options?
Treatment options, well, first of all, there's removal of the mole, and according to the severity or the degree of spreading, it will be either chemotherapy or radiation or further surgeries. But that will depend on the stage.
Okay. What treatment did the patient receive, and how effective was it?
Well, one of the patients had localized melanoma. It hadn't spread, so the only treatment he got, it was just removal of the mole with clean borders. The lymph node test came back negative, so that means it didn't spread. If it would have spread, he probably would have needed chemotherapy or radiation.
What will happen to the patient if he didn't receive the treatment?
Melanoma would have spread, and the patient would die.
What new technologies now exist for preventing diagnosis or treating this disease?
Well, there's the basic mnemonic for monitoring moles, which is the ABCDs of skin cancer. You have to check for the appearance, the borders, the colors, the diameter, and the evolution of each one of your moles. So preventing will be key here, education, and some new techniques, and like maybe surgical techniques, and some chemotherapy guidelines.